Hey guys, so the psychiatrist has actually been reaching out to me because he thinks I need shock therapy. It's not really necessary shock therapy. It's a really bad term because it's so different now. It's just like
it is.
It's just like stimulation of the brain. It focuses on the frontal cortex and things around the area of the brain. But
So it doesn't burn your brain. Is it wrong?
according to them, they don't have side effects. You might have a slight headache, but the problem is that for me, it's called TMS. I don't know what exactly the name is, but I just rather call it shock therapy because I don't know. Maybe it's temporal stimulation. I'll call it stimulation of the mind or whatever. So anyway, the psychiatrist wanted me to do it, and the reason why I turned it down is because you got to have 36 sessions. For the first couple weeks, you got to go 5 times a day, and with gas prices being so high now and driving 40 minutes away, I'm not into that, and
Yeah,
I guess that's what prevented me from doing it.
Maybe you should be, though, because what are you going to do? What else is there if they're giving you an option? Now you're just being stubborn. What do you think?
I might be stubborn, but what happens if there is a side effect and it turns my brain to mush because it's so new of a technology?
It is. I don't know. It kind of scares me still, too. But what about weed?
Weed can cause psychosis, even though people mention that. So,
Maybe,
guys,
can he prescribe you weed?
what I'm going to do is link the psychiatrist video on TMS because he might add something to it, but I just want to put that into clarification that if meds are not working and you want something to work and you have really unbearable depression, it doesn't help with bipolar mania, but it does help with bipolar depression and manic, what is that word? Major depression, and
Borderline?
And it doesn't help with psychosis. It doesn't help with schizophrenia.
Are you positive?
It does help with depression. And if you have this really bad depression and meds aren't working and therapy's not working and then consider TMS because it could save your life. And maybe I'll get it in the future, but right now it's just so much easier to take a med, and that's why I deal with it that way because I really don't want to spend 36 sessions just to get my brain zapped and here and there, and I don't know, what if it doesn't work? I just wasted 36 days of my life. And I mean, if you're at that situation, don't be like me. If you feel it's hopeful, then do it. Talk to the psychiatrist because I do know when I'm on Medicare and Medicaid, it is 100% covered. I don't know the exact cost, but I just know it's covered, especially in Minnesota. And I just want you guys to look at it. If you have a psychiatrist, mention TMS because it definitely could be beneficial. So, is there anything you have information about TMS that
I don't know anything about? I thought I have this really stereotype that it burns your brain, and like grandma, where it just turned her brain to mush.
My idea, it's just like those. What do they call those things?
Stimulant.
That with that pain receptor thing. What is that?
Dad's nerve thing.
No,
for backs.
Yeah, what do they call that? What do they call that?
TRS or something?
No, it's like they zap you. What is that?
Yeah, like a shocker.
It's not shock therapy though.
No, it's just it runs by electrodes.
Yeah, so
I can't remember what that's called. Let me look.
So it's just it's for pain and stuff, like stimulation and stuff, and it's like a TENS unit.
Oh,
I believe
TENS unit. There you go.
So I feel like that's what they do your brain.
What if you just put a TENS unit on your brain?
I don't know if that'll work.
So
it's gonna suck because I hope they don't shave me bald. They never said anything about that,
but anyway. Maybe we can talk a little bit about Ukraine. Does that make you not want to kill yourself? And that does it make you appreciate how good we got it here? Or is that still not help?
The focus is TMS. Oh yeah, there's 2 different types. I don't remember the types, but one's an older one and one's a newer one.
Should probably
I'll have to look at it, but I'll probably list the links below about what each description is about each of the information that's been given me by one of the texter. So this is a short video. Please like, comment, subscribe, and hit the bell button. Thanks. Bye.
Bye.